Hey YouTube, I'm here to talk about my experiences so far in my clinical site for the CNA program, and I'm just going to talk about how I feel about the facility that I'm in, and I'm also here to talk about what I've done so far within the skills. First off, I'm going to just talk about what I've done when I started doing clinicals. And this site is a rehab slash subacute, so it's double purpose, and I believe this place is so random, like it shouldn't belong to where it's supposed to be located, because around it there's a lot of houses, and then boom, uh, a nursing home is right there. And I wouldn't know that would be a nursing home when I first drove there. But this is my second week, I believe, second week in the same clinical rotation start, and then tomorrow will be my third week. But I believe next week we'll be going to our new clinical site. um Now I'm gonna just talk about what I've done so far. I've done giving a bath, um feeding patients, um, um, the change of their underwear, change of a nightgown, changing linens, and the bed. Like when the patient is on the bed, like I change the linens when they're wet. I've done food and fluid intake, and I recorded it in the logbook so it could be read by other professionals. I've also done um, passing out the trays from door to door. I also did a modified bed bath when a patient is on their bed. I also did a application of a TB hose or a stocking. I've done that. I've also done, yeah, I think that's basically it. And I've done, yeah, I've said everything so far. Um, and I did the urine and input outtake. I poured the urine into the beaker cup, and I measured it, and I reported it to the CNA that was teaching me. So yeah, that's what I've done so far, and it was a great experience. And I followed by the book that we are supposed to do when we do our exit certification exam. And excuse me. And what I feel about the facility is really, it's like, wow, it's interesting because I believe the people that work there are not really too nice, or and they like to take shortcuts. And I after that, like, I really believed my teacher that a lot of them do shortcuts, and it's really hurting a lot because it is ignoring the safety and mostly the infection control wise, because I've seen a lot of things that shouldn't be happening. Like, I've seen so far that people would put linens or soil linens on top of the soil linens where food is supposed to be, and you're not supposed to be putting anything on top of that anyways, because it's the place where the patient eats, the table, the rolling table. And then I also seen like people putting soil linen into the floor, You're not supposed to do that. Uh, you're supposed to put it straight to the soiled linen container or at the side of the bed. Um, Also, it was just mostly about safety and infection control. Like they didn't, I didn't really see a lot of it like through the book. It was just they did it like shortcuts. There's just a lot of shortcuts that they do. Also the way they um, whatchamacallit, like clean patients. You're supposed to get basins and fill them with water, and people just go to the bathroom and use the sink to wet the towels, and then they do it that way, and they place the wet rag on top of the table or the person's drawer, like on top of the drawer, and it was terrible. Like I think, I don't know, it was terrible to me, like things that I shouldn't be knowing, but I always, when I do something by myself and when am told to do something, I follow by the book. So I learn the proper way, because when you do the certification exam on December, they want you to do it perfectly towards the book. So that's what I'm doing. Also, some people that work there, they are really pushy, and I believe that if a patient or resident doesn't want to do certain things, he or she could be listened towards though, because the CNA, the people that work there, they just want to get their job done. That's the point, right? Getting their job done. But the thing that they're not realizing is that the person's privacy and the way they want to just not to do certain things technically, like taking a bath, going out and eating maybe. And yeah, there's just things that I've observed. What else can I talk about? Oh yeah, I've done research. Well, a classmate of mine did research about this facility. I can't tell you the name because it's privacy. And it's no obvious that they gotten the rating that they should be getting, because I definitely believe that they deserve the rating. But this facility got 1 out of 5 by the public health. And the reasons I just said earlier, I believe it really affected that outcome, that the facility's rating is 1 out of 5, and that's really low. And I heard that if they don't step up their game and they don't do the proper way and the proper things, they could possibly the public health could possibly close down the facility, because due to lack of compliance of safety, infection control, standard precautions, workers and patients' rights, like all that. And I totally believe that they've gotten that kind of rating. Well, that's about it for now, and I'll talk to you guys soon. And just tell me what you guys think about this, okay? And just subscribe, like, message me, and I'll talk to you guys soon. Okay, bye.